Thank you, everyone, for joining. We'd like to get started. I'm Mandana Khalili, Professor of Medicine and Director of the UCSF Research Coordinating Center's Investigator Development Unit of the NIMHD Health Equity Action Network. I want to welcome you to our monthly training webinar. Before we start, we'd like to acknowledge the Ramaytush Ohlone people, who are the traditional custodian of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Well, today we are grateful to have our wonderful librarian, Ms. Ariel Deardorff, speak to us on Get Up to Speed on the new NIH Data Management and Sharing Requirements webinar. Ariel is the UCSF Data Services Librarian and member of the library's data science team. In this role, she teaches classes and provides support for research data management, open science, and reproducibility in the health sciences. She's an expert in research data publishing, and she has led libraries' involvement with several data infrastructure and policy projects. Ariel is also an open science advocate who performs research on the role of the library in enabling open and reproducible research. Ariel, we welcome you and look forward to your presentation. Thank you.
Awesome. Thank you so much. And thanks everyone for inviting me to come and present about this new policy. I would love to get a quick snapshot of who is joining me today. And so maybe if you have a moment, if you could introduce yourself in the chat, your name, where you're coming from today, institution or physical place. I always find that interesting. And then maybe what kind of data you work with. I think that's really helpful for me as we go through this presentation. So I'll give you just a minute or so to put some thoughts in the chat. Yes, and thanks for the summary there, Mandana.
Yeah.
All right. We've got some folks working with claims data. Welcome. Data analysis, neurodegenerative, epidemiology, coming from UCSF, coming from Maryland, claims, Wayne State, clinical research. So it's great. A very interesting group of projects. All specialties. I love it. That's folks from New York, from Illinois, qualitative data. Ooh, good to see that. Red Cap, Arkansas. Great. Well, thank you. And feel free to keep typing as you, if you're just joining. This is really helpful for me to get a sense of where you're coming from and what kind of stuff you're working with. Excellent. Well, thank you again and welcome. So I already had a great intro, but just to summarize, I am Ariel. I am the Data Services Librarian here at UCSF. Because we did a land acknowledgement, I'm actually physically located in Seattle. That's where I'm joining you from today. You can see my cherry blossoms. These are the University of Washington campus where I went to undergrad. And I'm coming here today as really an educator. So that's my role on this policy. So sometimes I talk with people and they're like, oh, why are you making me do all this extra work? And I like to gently remind them that my role is really to train you to be able to meet these new requirements and to be a partner with researchers to kind of help you understand what you need to do. How can you work with data more effectively? And how can you prepare this data so that it's easier to share when you have to then make it public? I'm also a researcher, so I've written papers. I have shared my data as well. So I have experience sharing quantitative and qualitative data. So I understand, that this is sometimes extra work and what some of those struggles look like. So that's just a bit of framing for me and kind of how I approach this topic. So agenda for today, we'll talk about this new policy, what it is, how it impacts you, what you need to do. Then we'll talk about how do you actually plan to share your data. So what do you need to do kind of at the beginning when you're putting together, when you're actually writing your data management sharing plan? And then what does it look like, a year later, 2-3 years later, when you're actually going to share the data? We'll talk about what resources are available, and then we'll should have a good amount of time for Q&A at the end. If you have any questions as we're going, feel free to just throw them in the chat. I've got that up here so I can, I'll be monitoring them as they come in. All right, so let's dive into it. So what are we talking about today? We're talking about this new NIH data management and sharing policy. This went into effect in January of this year. So basically everything that's submitted or goes up for competitive renewal after January 25th of this year will need to, generates scientific data. So all NIH research that generates scientific data will need to submit a data management and sharing plan. We're talking about 2 pages, but generally the idea is this is a plan talking about how you are going to manage and then how are you going to share the data generated through your research. And here the emphasis, what's new is there's really an emphasis on maximizing the appropriate sharing of scientific data. So data sharing is not 100% required. We'll talk about what some reasons you might not want to or need to share your data. But really we are pushing the envelope here towards having this idea of data sharing as the default. When we talk about data sharing or sharing the data underlying your research, this is not something you're doing, 5 years after your grant finishes. The emphasis is really on doing this as soon as possible. So either at the time of a publication or the end of the performance period. And everything we're going to be talking about today is the minimum requirement. So this is the overall NIH policy. But some institutes and centers within NIH have more specific requirements. So I know that you all are funded by the National Institutes of Minority Health and Health Disparities. So they do not have a more specific policy, but it's always good to double check because some institutes will say, you need to submit to this specific repository. Some of them will have, you need to use these specific clinical measurements in your projects. So you want to always check your funding announcements and just make sure there's nothing more specific that you need to be paying attention to here. But let me get the acronym right, the NIMH does not have a more specific policy. So everything we're going to keep it at the general level today. So here's my TLDR, what's the major takeaway here? There's a new requirement for a 2-page data management and sharing plan that's much more detailed than previous data sharing requirements. So in case you're thinking, didn't we already have to do this? We'll talk a little bit about what's different from what you've done in the past, perhaps. And really the baseline has shifted towards data sharing as the default. So in the past, there were some data sharing policies, they're pretty minimal, and really you could opt out. Here, we're pushing the envelope, pushing us to think about sharing data as the default. So what's the overall goal of this policy? So lots of different goals, but really one of them, the major one, is to increase the public access to the results of federally funded research. So we've been, this has been an area that NIH has been pushing for years now, as well as the whole kind of White House Office of Science Technology Policy is, can we make taxpayer funded research available to taxpayers? And we've been focused on, the publications side of things, but really making that data available as well. It's also an effort to increase transparency and reproducibility of results. So more and more saying, in order to verify that something was done in the best possible way, or to really understand how somebody made certain decisions in their research, wanting to be able to look at the data underlying publications is a really crucial step. So trying to make that data more publicly available to improve transparency of research. And finally, to make data available for discovery and reuse. This is, I think, the biggest part of this is, this idea that we don't always need to generate new data for every topic. There's lots and lots of amazing data that we're all collecting. And if it was more publicly available, there's some really great questions and kinds of research that could be done using that already existing data, so secondary data analysis. So everything from replication studies to meta-analyses to being used for education, right? Having access to real research data for students or other people who are learning new research methods is incredibly valuable. So this is something that, I try to get people to think about. Really, your goal here is sharing your data in a way that other people could actually reuse it for future projects. So what is included in this new policy? I've given you a very high-level overview. So first of all, I mentioned that this is based on or building off of previous policies. So in case you're thinking, I thought there already was a data sharing policy, you're right. The first one was back in 2003. NIH had its first data sharing policy, but it was very minimal, I'll say. It said everyone who gets over 500,000 in direct costs has to write a data sharing plan, but the plan could be 2 sentences and it could say data does not need to be shared, right? So very minimal, and there wasn't a lot of compliance with this. In 2008, we saw the public access policy, which was focused on publication. So making sure that the articles that you're writing paid for by NIH were accessible to the public. So making a copy of that article available in a publicly accessible place, PubMed Central generally. In 2014, we had the genomic data sharing policy. So this was a more rigorous policy saying you need to make the data that you're working with publicly available, but it was only for genomic data. So if you've been working with genomic data, I don't think I saw a ton of you saying that in the chat, but if you've been working with genomic data, you've been doing this kind of data sharing for a couple years now. And so what we've got today now with the new 2023 policy is really applying this genomic data sharing policy to everyone. So now any kind of research, whether it's qualitative, whether it's secondary, whether it's genomic, clinical, falls under this new policy. So what do you have to write? So the policy says you need to write a data management and sharing plan. So what goes into this plan? So I should have taken out this max. It originally said max 2 pages. Now they're being a little more open to kind of whatever page limit. But in general, you have 6 elements that you need to discuss. You need to talk about the data you're collecting. What's the general size, scope? Is it qualitative? Is it quantitative? Is it coming from clinical measurements? Is it through interviews? Then you talk about what tools or software are needed. Do you need this expensive proprietary tool? Are you using, are you writing your own R packages? How is somebody going to actually be able to work with and understand that data? Then you have standards. This is a very broad category. We'll talk a little bit more about this later, but this could include things like standardized clinical measurements. It could include standardized file formats or standardized ways of organizing your data. Then data preservation. So this is talking about where are you going to make this data public? What repository are you going to use to publish and share your data? And when are you going to do that? Then the access piece is thinking about if you're working with human subjects, which most of us are, how are you going to ensure that the way you're sharing is respects patient privacy, is done in an appropriate way? So are you putting it in a controlled access repository? Are you de-identifying the data? If so, how? We'll break that down in a little more detail. And finally, who is doing this work? So is it the PI? Is it a data manager? Do you have a clinical research coordinator who's taking this on? Kind of just laying out the responsibilities for everything described in the plan. So in general, what you're actually going to have to do at the end of the day is you're going to have to write this plan. And so we're going to unpack now kind of all of the different pieces and parts that go into writing this plan. But as a reminder, this is the main takeaway, is this new requirement for this plan. So something I like to emphasize at the beginning is that we're talking about data sharing as the default, or really pushing the envelope towards data sharing, but not all research data has to be shared. And this is very clear in the policy. And these are some of the reasons why data sharing might not make sense for you or your context. So some of these are if you're working with existing data where you didn't get consent to share, or you said things like data will be destroyed. That really limits the scope of your sharing. And in that case, you probably would not be able to make that public. So thinking about consent, working with your participants, getting their consent, informed consent for data sharing is really crucial. The next kind of category is hey, I'm working with a population that even if I de-identify the data, it's a small group, it's, it's a really sensitive topic, it's a very identifiable, maybe small cohort of folks, or it's a rare disease. I don't feel comfortable even going through, privacy protections, making that public. It could put people at harm. It could put them at risk. So this is a big category here, and may be relevant to you. And so if that's the case, data sharing might not be right for your project, might not be right for your participants, and that's totally fine. The next category is if there's kind of any federal, state, local, tribal laws or regulations that would prohibit kind of disclosure or sharing. So if you're working with a population that has different laws, whether it's international or tribal, you have to respect those laws. So you're not going to then go ahead and make that public. So making sure that whatever you're doing is aligned with your kind of local regulations. And this next category is agreements. So I saw a lot of people talking about claims data, Medicare data. So when you access that data, you almost always sign some kind of data use agreement. And generally those are quite robust and you're not able to make that public. So rather than you going ahead and sharing the data that you got through like a secondary, that you're doing a secondary data analysis project on, you will say, I'm not able to make this data public because I signed a data use agreement in order to access it. And then this last category is sort of if you're working with lots and lots of maybe handwritten notes or something that is not in a digital format, and just the actual practicalities of digitizing it would just be infeasible. So if any of these apply to you, you still need to write a plan. And you still need to submit a plan, but in your plan, you will talk about how you will not be sharing because of these reasons. So just a reminder, everybody has to submit a plan, but not everybody has to share their data. I see a question about consent and optional consent, and let's come back to that a little bit later, because I think I'll talk about that a bit. Okay, so where should I share my data? So when we're talking about data sharing, sometimes people are thinking like, I share data all the time. I work with different institutes, or I share data with collaborators. That's great. But what we're talking about here is actually making it available in a repository. So a discipline or data specific repository is ideal if there is one for your discipline or data type, but there's not one for every discipline. So there are also NIH has a long curated list of repositories that it supports. And then if there isn't one for your data or discipline, there are also generalist repositories. So repositories that really take any kind of data. So Dryad is one that I wrote here, but there's also ones like Figshare or Mendeley, Zenodo that you might have heard of. There's a lot of repositories out there, and NIH is not telling you need to use this one. So they're kind of leaving it up to the investigators to decide which one looks the best for you, which is nice, but also is a little more work on the researcher side to then decide which repository to use. So we'll talk about that in a little bit. And then how are these plans evaluated and enforced? So program staff are assessing these plans. These are not part of the peer review process. You're not going to get a score based on your plans. Program staff are looking at them, and they're kind of looking at how reasonable they are. That's all we have to go on right now. So, doing your due diligence, writing a plan, hitting all those major points that are outlined, I think is kind of what you're shooting for at the moment. But it is important that whatever you write in that plan is part of the terms and conditions of your award. So you want to make sure that you're writing a reasonable plan that you can actually follow through with, because non-compliance can result in termination of the award, and we wouldn't want that to happen. You will be probably reporting out on the compliance during your progress reports. So as with everything, I mentioned this policy just went into effect about 2 months ago. So some of these things about compliance and what monitoring is actually going to look like in terms of like what form you're going to need to fill out are all still being determined. But just to give you a sense, this is not part of the peer review process, but what you write in there will be a terms and conditions. So you want to make sure you're doing a good job. And finally, how do I pay for this? So this is, new work to a lot of people. It's probably something that you haven't been doing. So there can be costs associated with this. And so you want to make sure that you're thinking about those costs in advance and including them in your grant. So some of the categories of costs to be thinking about are things like data curation or developing documentation. So are you going to be doing the de-identification? Is that somebody on your team? Are you going to need to hire somebody to do that? Are you going to need to take some time to like prepare the data for sharing or to work with a team of curators at the repository? Local data management considerations is really about, is there any special infrastructure that you need locally before you make it public in a repository? And then when you select a repository, some of them do have fees. So if you see that there's a fee associated with the repository, you want to make sure to include that in your grant so that you're not surprised by that later on. Okay, so that's the very high level overview of the new policy itself. So now I want to take some time to talk about how do you actually do this work and what are you doing when? So I've broken this down into three main kind of time frames. The first is project planning and grant writing. So this is your putting your project together, you're writing your grant, you're writing your data management plan. The next is data collection and analysis, so doing all the actual research, collecting and analyzing your data. And then finally, when you're starting to publish your articles, you're sharing out the results. So we'll go into all of these in a little bit more detail. So project planning is really about checking those sponsor agreements, incorporating data sharing into your consent forms, researching those data repositories, designing your study using standards, incorporating costs, and then summarizing all of that in your data management and sharing plan. So let's break each of these down in a little bit more. So checking your sponsor agreements. So I said at the beginning, you want to make sure that you look and see, does my specific institute that I'm hoping to get funded by have a more specific policy or more specific things I need to do? So in this case, if you're getting funded by NIMHD, they do not have a repository that they call it or anything the more specific you need to pay attention to, which is nice. So just making sure to double check all of that. Sometimes they call out, a specific repository, a different timeline, different standards that you need to use. So once you've checked that, then you're starting to think about, how are you going to work with participants? So getting consent from research subjects in advance to share their data is really crucial. NIH has some sample consent language that you can use. They actually have like a whole guide to consent. And I'm seeing Eleanor's question about, can data sharing consent be optional for participation? So I think that I would check out this guide from the NIH because I don't know that I think that you can do that. And you're, I don't remember which institution you were with, but your institution might also have guidance on that. Because I think if you do that, you just need to make sure that you're tracking, right, who consented, who didn't to data sharing, and then taking that out of your out of the data that you are making public. Yeah, so I'm not sure that I completely answered that, but I would take a look at this guide from the NIH because I think they get into that a little bit, thinking about, do you need to consent everyone? Can you do just partially? And then how does that impact the data that you share? So also at the beginning, this is when you're doing your research on data repositories. So definitely before you start collecting any data, it's good to know, what files are you going to need to submit? Are there standardized file formats that are required by this repository? And then just getting a sense of what's the turnaround time? Is this something where I can, click in, upload data, submit, and then it's live, 5 minutes later? Or is this something where I reach out to the curators and they will want to have a meeting with you? They will want to talk about your data. There's like an intake process, these really vary. So on one side, you'll have the completely like click upload. The other side, that it might be, kind of weeks of back and forth conversations and working with your data. So you want to understand what that looks like for the data repository that you're interested in. And certainly, are there any costs associated with that? So how do you pick a data repository? I mentioned that there's a lot out there. NIH has a super long list. So the way that I like to think about this is kind of through this flow. First, is there one named in your funding announcement? So for example, if you're ever trying to get funding from the National Institutes of Mental Health, they almost always require that you submit to their repository, the National Institutes of Mental Health Data Repository or Data Archive. So if that's your case, great, you're done. that's where you're going to submit. If not, is there one specific to your discipline or your data type? So here you can take a look at this NIH sponsored repositories page, or I really like the guide from the Scientific Data, it's a data journal. They have a really nice guide that's a little bit more curated. It's broken down by like sub-discipline. And finally, is there a generalist repository available? So NIH has also partnered with a group of generalist repositories that just take all kinds of data, and that is a great place to look for those. And another thing I like to emphasize here is, at the beginning we talked about what are some justifiable reasons not to share. But I think another thing that you can consider when you're looking at data repositories is that there's really a spectrum of options here. So on one side we have open access repositories, which is really an example being Dryad, Figshare, Zenodo, where anybody can access and download the data. So you'll put your data there, anybody in the world can click, access it. In the middle, which we have what is called controlled access repositories. So for example, the qualitative data repository, a lot of the NIH funded ICPSR repositories, Vively is a clinical one. Anybody can find the data, so they can find the kind of landing page with the description of the study, but in order to access that data, you generally need to apply. And depending on what level of access controls you put in place, they might need to have an IRB approval, they might need to sign a data use agreement. Some of the very, very controlled ones, they might need to go to a physical data enclave in Michigan or something like that. So there is definitely a spectrum of kind of controls you can put in place. And then the final side is just not sharing. So this is, any kind of data, even fully de-identified about this population would put them at risk. I do not feel comfortable with that. I'm not going to share. It would violate agreements. I didn't get informed consent. These are all reasons that are justified not to share. So when you're thinking about repositories, kind of thinking about this spectrum, right? It doesn't have to be that it's completely open or that you're not sharing. There's also this kind of controlled access repository space in the middle. All right. So these are some examples of repositories that are out there. So I mentioned Vively is one for clinical research. I saw that some of you are in clinical trials, and this is a really fabulous option. It is a controlled access repository, I think, across the board, meaning that folks will need to apply to access the data, and it is very well regulated. They have a data control board that they work with. It's very, there's a lot of controls in place. Another great option, I saw some folks talking about qualitative data, is the qualitative data repository. This is another one that has different levels of control available. So you could, for example, say, I'm doing an interview study. So maybe I want to make the interview protocol publicly available for anyone, but the actual transcripts or the de-identified transcripts, I want to make available only to, qualified investigators who have IRB approval and who apply to access it. So some other ones that I've highlighted here are all associated with the repository ICPSR, which is a social science data repository. They have kind of sub-collections that are funded by different NIH programs. So they're more kind of health science related. So one of these is the National Addiction and HIV Data Archive Program. There's the Data Sharing for Demographic Research Program, and the National Archive of Computerized Data on Aging is another one. So all of these are part of what's called ICPSR, but they're more specific to kind of sub areas of research. And so finally, there's something called Open ICPSR, which is kind of a generalist repository focused on social science data. It's interesting, it's called Open ICPSR. It does allow controlled access options. So keep that in mind. If you can't find a place to put your stuff, that's a good one. Something I forgot to add here is some of these do have fees associated with them. So Vively has a fee, the qualitative data repository has a fee. I believe that all of these ones are free. So something to keep in mind as you're looking at repositories. And your institution may or may not pay for memberships to some of those repositories as well. So that's another thing to consider. So we're talking about still designing our studies, picking a repository, and then looking at standards. So first, I like to look at the repository, because your repository might say you need to use these clinical measurements, or you need to arrange your data in this way in order to upload it into the repository. So that's really good to know early on. So common data formats, standardized clinical measurements, specific data dictionaries or identifiers, et cetera. So where do you find these? So I already mentioned your specific data repository. So if you are working with kind of more survey data, social science data, there's something called DDI, or the Data Documentation Initiative, that has a specific recommended kind of metadata or data about data formats for survey data. So I've put some example links in here, so you can take a look at those. Other ones, if you're working with clinical data, NIH common data elements, or kind of standardized clinical measurements that you might want to look at. Those are really a really great resource. And then some other places to look for just standards in general are fairsharing.org and the DCC disciplinary metadata. This is a great place also to talk with your local research librarians at your campus, because metadata and data documentation are something that they think about a lot. So I'm sure they can also point you in the right direction. Okay, so then costs, I mentioned already, thinking about how much these things cost. So who is going to do this data preparation? Are you going to hire that out? Are you going to work with a repository and maybe pay them some money for it? Are you going to do it locally? And then is there a cost associated with your data repository? So if so, you want to incorporate all of this into your grant. Unfortunately, you're not getting more money to do this, but it is good to think about what these things cost and incorporate those costs. All right, and so all of this work is really being summarized in your plan. So this is a photo of the NIH template. So they have a 2-page template that really breaks down kind of all the different pieces of information that they're looking for. So we already talked about, data type, related tools, software, standards, et cetera. And there's a link to the specific NIH template. Okay, so you've done all this work, you've submitted your plan, you've gotten your grant, amazing, now you're doing your research. So as you're doing your data collection analysis, really what you're doing at this point is following your data management and sharing plan. So if you talked about specific standards, you're going to use those standards. You're going to keep your data ideally well maintained, well annotated, well organized, so that when you go to share it, you're not having to find which was the right version and it's in a different file format, or it's really messy and hard to pull it all together. Good data management throughout will make it much, much, much easier to share at the end. Okay, so now we're at the end of the process. You're publishing, you've written up some really great articles. You're starting to submit those, present at conferences. So this is really also when you are preparing your data for sharing in repositories and uploading it to repositories. So preparing data for sharing. So this is the part where if you haven't well maintained your data, this can take a lot of time. And even if you have well maintained your data, it can take a lot of time. So this is when you're thinking about, is my data de-identified? If it's if I'm working with qualitative data, did I think about not only the direct identifiers, PHI, but am I thinking about indirect identifiers? So information that when triangulated can still reveal identities. So there's a great guide to qualitative data de-identification that's part of the qualitative data repository that I've linked here. And then it's not just de-identification, but it's thinking about packaging everything together. So in general, when we're sharing data, we're not just sharing the kind of, survey spreadsheet, but you're thinking about, what would someone need in order to understand that? So things like data dictionaries, your guides, your interview protocols, any kind of clinical protocols that would be needed in order to interpret that data. In general, if you can save things in open or common data formats, that's better. It just makes it easier and more accessible for other folks. And just a reminder that this step can take time. So especially if you haven't been practicing good data management. And so once it's been prepared, once it's been de-identified, this is when you're starting to work with that data repository to submit your data. And as I said, depending on where you're submitting, this can be, a couple hours of work, or it could be kind of ongoing weeks of kind of back and forth. So once it's submitted, you will get some kind of unique ID for your data set. This is often generally in the form of a DOI, or digital object identifier. Sometimes they also look like accession numbers. So this is what you will use in your progress reports, and this is what other people will use when they cite your data. So we're really moving in this direction where data sharing and this idea that data is a product of research as similar to publications, right? So you write papers, you produce data, maybe you even have some fabulous code that you wrote, and all of those should be cited because they're all valuable outputs of research. So if somebody uses your data, the idea is that they will cite it in their citations as they would articles that you wrote. So here are two examples of data citations. Here we have one from Dryad, the generalist repository I mentioned. Here's the DOI, the unique ID for that data set. And here's one that's from Import, which is an immunology database. And here is the unique ID for that data set. So I also say, if you're sharing your data, you should put these citations on your CV because they are, once again, valuable outputs of research. All right, so just wrapping up here, let me take a quick look at the time. Okay, great. I want to point you to some resources. So there is a lot of great information on the NIH data management and sharing policy website. They have sample plans. So this is what I highly, highly recommend, that as you're sitting down to write these plans, you look at these sample plans. They have, I think, about like 10 or 11 at this point for secondary data analysis, for survey data, for clinical research, for clinical trials, for all different areas at this point. And you can get a sense of, how detailed should these be? You can just copy and paste the language. You can just base your plans off these as much as possible. So I definitely recommend taking a look at those. You can also find the overview of all the different NIH repositories. They have some good information about participant privacy and informed consent. And they have several webinars about the policy as well. So if you want to dive even deeper into the kind of policy language part of it, they have some webinars there. Another resource that I really recommend is DMP Tool. So this is a data management planning website that has all of these different templates. So they have the NIH template, but lots and lots of other agencies and funding groups have started requiring data management and sharing plans. And so what you can find on this website is it's kind of like a step-by-step plan builder where it will say, okay, well, in this section of the plan, you need to describe this, and then they'll have sample language. And they have sample language from different institutions. So if your institution is a member of DMP Tool like UCSF is, we have here's some suggested language for this section of the plan, as well as the DMP Tool and the NIH suggested language. So sometimes it's a little more than people want, but it can be really helpful if you don't have a lot of local guidance. And then the last thing is local guidance. So if your campus library or your grants office has put together any specific guidance, that's definitely good to look into. If you don't know, I would suggest reaching out if there's any kind of data librarian on your campus. I'm sure they have been paying attention to this. If you don't know who that person is or can't find them, you can always send me an email and I can probably hunt them down. I know a lot of these folks. But here at UCSF, we have a lot of local guidance that we've been developing. So we have our own kind of local sample plans, FAQs, things we've been talking with researchers about. So we also have some specific kind of recommendations just for our local campus. So I would see in your university or where you're located, what resources are available to you as well, because sometimes people have become members of repositories, so they're free. So you want to know all of those things sooner rather than later. All right, so our major takeaways here is that there are now new requirements for data sharing. So these are this is now in effect and will really impact all grants for research submitted going forward. So now is really the time to learn more about depositing data in repositories, but there are lots of resources available. So the ones I mentioned on the NIH, as well as your local campus resources. All right. Okay, so that is all I have. So I'm happy. I think we have about 15 or so minutes for questions. Let me just look in the chat real quick to see if there are any questions. Feel free to throw your questions in the chat, or if we want to.
Yes, we can certainly also have you raise your hands, and I'll be happy to call upon you. Thank you, Ariel, for that wonderful presentation and all these resources. We learned quite a bit. Maybe I'll start with one question. So as I'm understanding this, that all currently ongoing grants will need to also submit a data sharing and management plan. Is that correct? Or is it just new applications?
So it's new applications and applications that go up for competitive renewal. So if you're already working on a plan, you're already working on a project and it's been funded and you're not seeking more funding for it, this will not apply to you. Got
it. Excellent. Thank you for that.
Yeah.
And then I think the issue of consent came about, and well, you indicated one has to read into this a little bit more in detail. But I'm aware of, I don't know if the NDA is a data repository that you're aware of. And I do believe their sample consent does request that the patients would, sign a consent to agree that they're willing to publicly share their data, after which you're allowed to sort of deposit. Is that part of the consent question that was asked earlier on?
Yeah, I think the question was about what if you have folks that don't want to consent to data sharing but still want to be a part of the project?
Yes. So for this particular one, you can, you basically agree or disagree with the publicly having your data publicly shared, but your point is very well taken that it has to be very clear, and one has to look at those resources that you indicated to confirm. Another question I think that came, or another point that you brought up that was quite important, was to go and check with your institute regarding what the specific requirements may be. Do you have the link, for example, to that location? Because I did search rapidly and found that it was a little bit confusing. For example, some of them were very clear and it said, NIDDK requires this, but NCI was only clinical trials and nothing else. So it's hard to know exactly. Do you have any recommendations as to how to navigate that specifically?
Yeah, let's just go look at it right now. So yeah, it's definitely a little bit confusing. So ideally, so the sharing.nih.gov is kind of the main homepage that I was talking about with all the different resources. So they have a spot that is other sharing policies, NIH institutes and centers data sharing policies. So this is ideally where you would find all of the policies for all the different institutes. So for example, I was talking about the National Institutes of Mental Health. So they have an overall policy just for their grantees that you can find here. I've noticed that it sometimes takes a little bit of time for a notice to come out about a new policy requirement for it to get onto the spreadsheet. But this is where I would always start to just see, like, is there anything that I should be paying attention to? So when somebody reaches out to me and they say, hey, I'm funded by like NIDDK and I'm writing a data sharing plan, or I'm funded by NIMH, I will always check here first just to see, is there anything more specific? And then some grant notices I've started to see call out specific things. So they say, like, you need to include these common data elements in your project. So yeah, there's kind of a couple places to look.
So let's take one of these, for example. I was looking at NCI that has NCI clinical trial access policy right there. And so that in particular is related to clinical trials. And then the one above is just the general, or it's just a specific cancer moonshot public access and data sharing policy. So I see. And that's for genomic data, et cetera. So it sounds like they don't have any specific recommendations, for example, for say, qualitative studies, or for example, quantitative but epidemiologic studies. It doesn't look like it is, correct?
Yeah, so for For most of them, I think that their policies are more project specific. So, you know, they left it very open for institutes to come up with more specific institute-centric policies. I think the biggest one is NIMH. So mental health, they have their whole own thing. It's very specific. Most of the other ones that I've looked at, you know, in all of my kind of conversations with folks are specific to either a clinical trial project or a specific, like, you know, consortium-wide data on this topic. So it's always good to check. Unfortunately, another thing about these is some of these are old. So if you look at some of these, they might have been superseded by the more general policy. So I think they're still kind of working on updating some of these things. So if you're ever confused, you don't know, you can either ask your local data librarian or you could email your program officer. So I've worked with people to email their program officer and say, just like, which of these policies do I need to apply to? Or does this apply to me? Or is there something more specific? And actually people have been pretty quick to respond. So that's been helpful.
Wonderful. We have a number of questions in the chat now. It says, how extensive should a DMSP be when it comes to data sources? My study will likely have healthcare data, can't share because of data use agreements, provided surveys, focus group surveys, et cetera, et cetera. So do I need to address all of them and just the main ones?
Yeah, so that's a good question. So I would highly recommend taking a look at the sample plans. I put the link in there. This is where the page where you have all the sample plans. So some of these do have, you know, a couple different sources of data, and to just get a sense of like how they're describing it. So here's one, for example, demographic, clinical, and MRI. We're talking about imaging. What we're talking about. I mean, that's really it. They have like 2 sentences. So in terms of like describing all of the data at the beginning, I generally break it down into categories and thinking about where is it going to go. So sometimes you're going to need to share your data in 2 different repositories because maybe you have like a lot of qualitative and then maybe you're doing a clinical trial with a lot of clinical data. Those might need to go in 2 different places. So I am just looking at this. If we're talking about surveys, focus groups, surveys, climate data, you can always make a table. So you could say, you know, I'm collecting this. It's about this many surveys from this many people, or focus group, you know, interviews from this many people. I don't really know what climate data looks like. I don't get to usually work with that, so don't have a sense of what size or scope, but you can always do a little table or just describe, and then just make sure that, you know, if you're talking about, you know, all of this will be shared, I generally make sure that you bring that back kind of throughout. So here's the tools, or here's the standards that are related to the clinical versus the climate data. I'm sharing the climate data here, I'm sharing the clinical here, or surveys here, et cetera. So
thank you, Ariel.
Tracking it throughout. Yeah.
We have a question from Teresa. Teresa, do you want to ask that in person, or do you want me to read your question? Oh, go ahead.
Yeah, I can ask it in person. And this is more of like a technical question, but as part of a lot of subawards, they include a data use agreement between the subaward or the subaward institution and the subrecipient. So essentially, does that imply that the NIH data sharing would not be required by the individual subrecipients because it's covered under the parent award?
Yeah, so I think in this case, is it that you're using data that's been collected by another project? It's kind of like a secondary data analysis approach. Is that right?
I think it's, so for our center, it's like the pilot project awards. And if it's an institution outside of ours, it has to be a sub-award setup, and most sub-awards include some sort of data use agreement as far as if a project under the parent award is collecting data, how that data will be shared with the NIH.
Yeah, so there's kind of 2 different angles to this. One is, what did you say in your data use agreement or data sharing agreement? Did it say that then you could make it public or not? If it said no, then that's, you just say that in your plan. Like we in order to access the data for this project, we signed a data use agreement that was very strict, and therefore we can't make it public. Another aspect of this is, you know, if you're accessing data that's already made publicly available, so if it's more of like thinking about it as secondary data, in many cases, you can just say, you know, we're not sharing the data, but if people want to access it, they would apply to this main parent award, or they would reach out to this project. Or if it's Medicare data, they would apply for Medicare data access. So get it from like the original source, basically. Does that answer your question?
Yeah, that makes sense. I think it's good to know for like kind of that continuing renewal with working with subawards for pilot projects or the early stage investigators of kind of, because this will change for future projects, how the data use agreements for subawards and getting the funds distributed. So thank you.
Yeah. And, you know, I think that's an area that I've worked with a couple of people, and sometimes that's another area where reaching out to your program officer and just being like, just to, you know, because of the mechanism here, or just to clarify kind of that you're doing it right.
Agreed. Teresa, reaching out to Dr. Stenson about the pilot award seems the most reasonable thing at this point. Okay, great. And then I have a question about really two great questions. Do the repositories hold the data perpetually, or is there a minimum time limit for the repository that has to hold the data to meet the NIH requirements? And off of that as well is, do you have any estimation of a ballpark of the costs for these data repository submissions?
Yeah, so it is funny. I think that in the policy, in the language, it asks you to talk about, you know, how long will the data be shared for. Most repositories that I've seen do not actually give like a timeline. They instead say things like indefinitely, or, you know, as long as they feasibly can, or something like that. So I'm trying to think if we've been, this is about the NDA, and I saw something in there the other day about like they just keep it for as long as they can. So it's always good to just double check, but most repositories I've seen, the timeline, the shortest timeline I ever saw was 25 years. Most of them talk about, you know, in perpetuity or indefinitely. So I think that's fine language to include. And then in terms of how you pay for it, the fee structure is generally about deposit. So you pay once on deposit in order to use that repository. Once again, it's always good to check. More and more repositories are like coming out all the time, and I think we'll see a lot more new ones because of this policy. So depending on the size and scope of your data, if you're working with like terabytes of data, you always want to reach out, because they might have more specific fees, or they might say, you know, we can only keep this 4 or 5 years because it's so big. So always good to double check. In general, though, the fees that I've seen range from about like the mid hundreds, so maybe like 400 or 500 to a couple thousand. I think Beavly is like 4,000 for deposit. So there's a bit of a range, and so always kind of double checking with your repository.
Ariel, can I weigh in about this as well? Because I think it is really important that the investigators are aware of this. So for example, the NDA, and I've only worked with that one specifically, so which is what is listed here in the middle of the page, that basically has a worksheet for submitting a budget. So if you look at that worksheet, it's an Excel sheet. The issue is not necessarily the cost of the actual the repository, because that's supported, for example, by the NIH. But what is the cost is all of the changing of your data sets to meet the requirements of the you know, forms that they agree to upload. It also is a cost for yourself, kind of, or your coordinator, or whoever needs to be depositing it, addressing queries, initially making those data sheets or forms, which you can then use to upload. So there's a lot of sort of costs that are there that one has to be thinking about, including the principal investigator reviewing the data for clarity, for ensuring that it meets all the various variable names and things like that. So it is quite a bit. If you, Ariel, if you go to the NDA, you know what I'm talking about, right? The NDA, maybe just to give them an example of what it's the end, and then yes. So
I will say this is definitely the most robust of any data repository I've seen. So I think they're on the one side of in terms of like how much time it might take. Let's see, where is
It's like a budget for, or if you actually go,
here we
yeah,
go,
there you go,
cost
cost estimating. And there's a tool, it's right there, it says, yeah.
Yeah.
If you open that up, so that just, even if you're not using this data set, just be aware of when you're asking for, in your budget for a cost, this is an example of the type of amount of things that go through in developing and submitting things. It was very, very helpful to me to see, oh, wow, there's a cost to this too, or there's a cost to that too. The data structures are what they're talking about this common data structure that you're going to create. And there were forms and things like that.
Yeah, and I think that your local campus might have some guidance around budgeting, but also I think this is where repositories can be really helpful. So this is the tool, as you mentioned, from NDA. The qualitative data repository really recommends that you reach out to them and give them an estimate of like, I'm doing interviews with 40 people and they're each an hour long, and like how much time and how much money do you think it'll cost to like prepare all of that? And they can be, they're an expert in that kind of data, so they have a better sense of like how much work it can be. So always reaching out earlier rather than later.
Right. Well, we're reaching the top of the hour, and I don't see anything else actually in the chat that we haven't addressed. So I wanted to thank you again, Ariel, for this very comprehensive presentation, your expertise. I know we all very much appreciated it. And we'll see you all at the next webinar. Thank you again, everyone.
Awesome. Thanks, everyone.
Bye-bye.